Hello, and welcome to this week's episode of Medisodes. This week is our part 2 on our healthcare systems series. This week we're going to be having our second episode about healthcare systems. So last week we talked about Germany, the UK, and the US. And this week we're going to be adding Switzerland, Singapore, and to start with, Canada. So without further ado, over to Adrian to talk about Canada.
Canada has a universal healthcare system. Canadian citizens and permanent residents can apply for public health insurance, which means that healthcare is free at the point of service for those insured. However, unlike the NHS in the UK, healthcare is not national, and each province or territory has its own health insurance plan, and each plan differs slightly in what it covers. Most people are covered by this insurance. Canada's decentralised, universal, publicly funded healthcare system is called Canadian Medicare. Healthcare is funded and administered by each of the 13 provinces, and each receives financial assistance from the national government on a per capita basis. Benefits and delivery approaches of this healthcare model may vary, but all citizens and residents receive medically urgent hospital and physician services free at the point of use. And this is an underlying principle of the Canadian healthcare system. Patients should not feel reluctant to use the healthcare system due to fear of cost. Canada's Medicare was established through laws and consolidated in the late 20th century. To be eligible for federal government funding, each provincial health insurance plan needs to comply with the 5 pillars of the Canada Health Act, which mandate that it be publicly administered, comprehensive in coverage conditions, universal, portable across provinces, and accessible. The latter means that there are no excessive user fees when they do have a need to use their healthcare insurance plan. The government of each province or territory has the primary responsibility of financing, organising, and delivering healthcare systems, and supervising providers. The law directly funds physicians and local research programs, and contract with sub-provincial health authorities to deliver hospital, community, and long-term care, as well as mental and public health services. The federal government finances provide universal health insurance programs and administers a range of services for certain distinct populations, including Inuit people, members of the Canadian Armed Forces, veterans, and refugees. It is also ultimately responsible for the safety and efficacy of medical devices and other pharmaceuticals that are delivered as part of the Canadian Universal Healthcare System. There are some specific functions that are regulated by the federal government in Canada. The first is Health Canada, or the Federal Ministry of Health, which plays a key role in the regulation of food and drug safety and upholds a high national standard for universal health coverage. The Public Health Agency of Canada is responsible for public health, emergency responses and preparations, and chronic disease control, such as COVID-19, as well as the promotion of good overall health, such as weight loss programs. Most local healthcare providers are self-governing under provincial law and are regulated on a local level. About 2/3 of Canadians have private health insurance on top of their universal public health insurance, and this covers services such as vision and dental care, outpatient prescription drugs, rehabilitation services, and private hospital rooms. In 2015, about 90% of the premiums for private health plans were paid through employers, unions, or other organizations. Much like the USA, employers may offer employment benefits in order to attract further employees. The majority of these private health insurers are for-profit. In 2017, there were 2.3 practicing physicians per 1,000 population, of which half were family doctors and general practitioners. Similar to the UK, GPs largely act as gatekeepers to the broader healthcare system in order to prevent them from being unnecessarily overloaded, and many provinces pay lower fees to specialists for non-referred consultations, deterring specialists from wanting to see patients who have not been referred by a GP. Most physicians are self-employed in private practices, and about 46% of GPs worked in a group practice. In several provinces, networks of GPs work together and share resources, with variations across provinces in the number and composition of teams. Currently, fee-for-service is the most common form of physician payment, though this model of payment is becoming phased out in popular of other payment methods, such as capitation. I'll now hand over to Anupam, who will be discussing healthcare in Singapore.
So, when discussing liberal health systems, there are scores of examples to choose from. For example, France and their multi-payer system, Canada, as we've just talked about, Germany's hybrid approach that we talked about last week. So, when it comes to a free market healthcare system that is considered a paradise, there really is only one example Singapore. But it is an incredible example. For example, in a New York Times column from 2016 called Make America Singapore, Ross Douthat called it the marvel of the wealthy world. And after the 2016 election, Fox News published an opinion piece headlined, "Want to ditch Obamacare? Let's copy Singapore's healthcare miracle." And the American Enterprise Institute explains it well. What is the reason for Singapore's success? It's not government spending. The state, using taxes, funds only about 1/4 of Singapore's total health costs. Individuals and their employers pay for the rest. The latest figures show that Singapore's government spends only $381 per capita on health, or 1/7 what the US government spends. Singapore's system requires individuals to take responsibility for their own health and for much of their own spending on medical care. Now, here's what Singapore gets right. It is the only truly universal health insurance system in the world, based on the idea that patients, not insurers, bear the cost of routine healthcare. But Singapore isn't truly a free market utopia, and it's actually quite the opposite. It's a largely state-run healthcare system where the government has designed all the insurance products with an appreciation for free market principles. Unlike in America, where the government's main role is in managing insurance programs, Singapore's government controls and pays for much of the medical system itself directly. Hospitals are overwhelmingly public, a large portion of doctors work directly for the state, and patients can only use their Medisave accounts to purchase pre-approved drugs, and the government subsidizes many of the medical bills directly. Singapore's system is an unusual fusion and shows that these sort of ideas are possible, and is a place where the government acts to keep costs low and uses the low cost to make a market-driven insurance system possible. A deep dive into the system is rewarding, but this summary will go over the basics. The basic structure of Singapore's insurance system is built around the 3 M's: Medisave, Medishield, and Medifund. Medisave. When people praise Singapore's health system, they're usually talking about this system. Medisave is a forced savings plan that consumes roughly between 7 to 9.5% of a working Singaporean's wages, which is sort of like a social security tax in the US. This tax goes to funding a health savings account for each Singaporean, who then pay for their routine care out of these accounts. This is good because it's built on a deep appreciation for the idea that routine medical care can be treated like any other good, and patients can be pushed to act like consumers when buying it. Medisave is what distinguishes Singapore's system from that of the US or Western Europe, which we touched on in the previous episode, where insurers typically cover most of the cost of routine care. In actuality, the Medisave account works because the government forces you to divert 7 to 9.5% of your wages into the account, and it's actually the government that decides what you can do with those savings. So while Medisave may look like a health savings account, it's actually a mandatory health savings account that's all funded by a payroll tax and only usable in certain conditions approved by the government. Now moving on to Medishield. Of course, not all medical care a person might need is routine, and for the big expenses, Singapore runs Medishield, or to give it its full name, Medishield Life, which is a nationwide catastrophic insurance program. These premiums are set by your age, and the deductibles are reasonably high, roughly $1,400. Enrollment, however, is automatic, although people are given the option to opt out. Together, Medishield and Medisave form the core of Singapore's market-oriented health insurance system. The idea is that you pay all your routine expenses out of your Medisave account, and if things get bad enough that you hit your deductible, you begin using your Medishield account. This combines with their broader, more conservative view on healthcare in Singapore. Insurance should cover unexpected costs, but for everything else, people should shop around as they do for most other products and unleash the powers of a free market. But to make that structure work, Singapore relies on a massive amount of government coercion across the entire system. Fully funding your Medisave account is compulsory, not optional, and you're automatically enrolled in Medishield. The government limits the services both programs can purchase, and as we'll see, often produces or reprices these services. Now finally, Medifund. Medifund is for the Singaporeans who fall through the cracks of Medisave and Medishield, and acts as a payer of last resort. This structure is unusual in 2 ways. First, it's based on a $3 billion endowment, with the government only able to spend the previous year's investment income to pay for the needy's medical bills. Dipping into the endowment itself is completely forbidden. Second, it's administered with a lot of discretion at the hospital level, so rather than qualifying for Medifund based on income, the way Americans do for Medicaid, Hospital boards administer Medifund to the patients they judge needy enough to qualify. However, this is less restrictive than it might sound. The government says that more than 99% of applicants are approved. The big vulnerability of Medifund is that a bad investment year could wipe out the government's ability to pay, and do so at the moment it was most needed. It's a testament to Singapore's economy and to the government's fiscal skill that they've not faced this problem yet. It's easy looking at Singapore's insurance system to see what people find so attractive in it. While there is significant government coercion, there's also a real focus on pushing patients to act like consumers and reserving insurance from unexpected, unusual costs. In addition, Singapore's safety net, Medifund, is limited in its commitments and administered at a local level. But this all happens with the context of a government-controlled and often government-run system. This is a key difference between two free market medical systems, such as Singapore and America. While the bulk of the American government's intervention is done through health insurance, Singapore's is done through the healthcare system itself. More than 80% of the hospital beds in Singapore are in public hospitals, and those hospitals are cut into different wards with different level of amenities. A-class wards provide unsubsidized care, but give you single rooms and air conditioning, while C-class wards are overwhelmingly subsidized, but at the cost of being set up like shared dormitories with common toilets. These subsidies remain a huge part of the country's overall health spending. In 2009, the 3 M's only financed 23% of total inpatient care. By contrast, government subsidies were 51%, although it's worth noting that these government subsidies are a lot less prominent in primary care. These subsidies are designed to do more than simply make care affordable. They're also designed to shape patient and provider decisions and influence pricing. Take pharmaceuticals. In 2009, Americans spent $947 per person on drugs, whereas Singaporeans merely spent $389. And a major way the Singaporean government holds down these prices is by deciding which drugs are eligible for subsidies and Medisave spending. The Singaporean Ministry of Health publishes a standard drug list. These are drugs the government believes to be cost-effective and essential, and drugs on that list are provided at a subsidized rate to patients. The government also decides which drugs can be bought with Medisave funds. Drugs that don't appear on either list may still be available in a hospital, but at prohibitive prices. Unusually, Singapore is quite secretive about how these pharmaceutical decisions are made. Britain's much criticised National Institute for Health and Care Excellence, something we talked about in last week's episode, makes decisions about which drugs will qualify in a similar way, but is far more transparent. A previous Singaporean health minister says their opacity is to prevent intense lobbying by pharmaceutical companies. What they want are pharmaceutical companies selling all drugs at low prices in the hopes of getting onto the list. That's how Singapore uses their subsidies to lower prices, not just for the subsidized, but for everyone. There's also the private sector to think about. As it's growing, it provides care to those who are privately insured, foreign patients who aren't covered by any of the previous three systems, or public patients who are able to afford what often amounts to very large out-of-pocket payments above the government subsidies. The private sector consists of both private healthcare and insurance, and utilises the pre-existing network of general practitioners and hospitals. The private healthcare in Singapore is often seen as having a large market amongst their more exclusive clientele, and attracts individuals in search of more advanced and complicated treatments, such as stem cell therapy or specialised cancer treatments. It's usually more appealing and preferred by expatriate citizens as opposed to the public. And 2 hospital groups operate the majority of private hospitals, Parkway Pantai and Raffles Medical Group, both large medical groups across Southeast Asia. These private hospitals are typically smaller, offer more privacy, and specialise in certain procedures. With all these benefits, the Singaporean system still has some issues. For example, in the early 2010s, the healthcare system faced shortages of hospital beds, which was attributed to an ageing population problem. In certain situations, hospitals had to temporarily relocate patients in other places or be transferred to community care facilities. However, since then, the government has opened 3 general hospitals and 3 community hospitals to cater to this increasing demand. Singapore's system is truly unique, but then again, Singapore itself is a unique country. As a city-state of about 6 million people, with the 3rd highest per capita income today, trust in the government is extraordinarily high compared to any other nation, and the government uses that to wield their power aggressively. So while their health outcomes are excellent, that's only because its health system is so well designed and well managed by their government. Now I'm going to hand over to Surya, who's going to be discussing Switzerland's healthcare system.
Let's start off by looking at how much is spent on healthcare in Switzerland. Healthcare costs in Switzerland were 11.4% of GDP in 2010. By 2015, the cost had risen to 11.7% of GDP, the second highest in Europe. Now let us move on to looking at the actual healthcare system. The healthcare system in Switzerland is universal and is regulated by the Swiss Federal Law on Health Insurance. There are no free state-provided healthcare services, but private health insurance is compulsory for all people residing in Switzerland within 3 months of taking up residence or being born in the country. Health insurance covers the costs of medical treatment and hospitalization of the insured person. Swiss residents are required to purchase basic health insurance, which covers a range of treatments detailed in the Swiss Federal Law on Health. It is therefore the same throughout the country and avoids double standards in healthcare. Insurers are required to offer this basic insurance to everyone, regardless of age or medical condition. They are not allowed to make a profit off this basic insurance, but can on supplemental plans. The insured person pays the insurance premium for the basic plan. If a premium is too high compared to the person's income, the government gives the insured person a cash subsidy to help pay for the premium. The other universal compulsory coverage provides for treatment in case of illness or accident, unless another accident insurance provides the cover. Health insurance covers the costs of medical treatment and hospitalization of the insured. However, the insured person pays part of the cost of treatment. This is done commonly by two ways: by means of an annual excess, which can reach a maximum of $1,534 for an adult as chosen by the insured person, or by a charge of 10% of the cost over and above the excess. This is known as retention, and it is up to a maximum of $429 per year. In the case of pregnancy, there is no charge. For hospitalization, one pays a contribution to room and service costs. Insurance premiums vary from insurance company to company. The excess level chosen, the place of residence of the insured person, and the degree of supplementary benefit coverage chosen. International civil servants, members of embassies, and their family members are exempt from compulsory health insurance. Requests for exemptions are handled by the respective authorities and have to be addressed to them directly. The compulsory insurance can be supplemented by private complementary insurance policies that allow for coverage of some of the treatment categories not covered by the basic insurance, or to provide the standard of room and service in case of hospitalization. This can include complementary medicine, routine dental treatments, half private or private ward hospitalizations, and other treatments which are not covered by the compulsory insurance. As far as the compulsory health insurance is concerned, the insurance companies cannot set any conditions relating to age, sex, or stage of health for coverage. Although the level of premium can vary from one company to another, they must be identical within the same company for all insured persons of the same age group and region, regardless of sex or state of health. This does not apply to complementary insurance, where premiums are risk-based. Looking at the overall summary of the organization of Switzerland's healthcare system, the healthcare system is a combination of public, subsidized private, and total private systems. An example of public systems of healthcare include the University Hospital of Geneva with 2,350 beds, 8,300 staff, and over 50,000 patients per year being treated. Subsidized private systems include the home care services to which one may have recourse in case of a difficult pregnancy, after childbirth, or illness, or accidents, handicap, or old age. And finally, the total private system includes doctors in private practice and private clinics. The insured person has full freedom of choice among the recognized healthcare providers competent to treat their condition, on the understanding that the costs are covered by the insurance up to the level of the official tariff. There is freedom of choice when it comes to selecting an insurance company, provided it is officially registered or a private insurance company authorized by the federal law, to which one pays a premium, usually on a monthly basis. So hopefully you've gained a good understanding of the healthcare system of Switzerland. Now back to Shrey.
We've looked at 6 different countries with a variety of healthcare systems, from the UK with its health system basically completely government run, through European nations such as Germany, who have a social insurance scheme, to countries like Singapore and Switzerland that have a more private focused healthcare system, but with still some elements of government funding. And then there's the US system, which is almost completely private, apart from Medicare. So let's summarize what are the best healthcare systems in the world. And to do that, I'm using the Commonwealth Fund's Mirror 2021 report, which is a report that's published every couple of years by the Commonwealth Fund, a think tank. And in this report, it takes 11 high-income countries, so that's Australia, Canada, France, Germany, Netherlands, New Zealand, Norway, Sweden, Switzerland, the UK, and the USA, and it compares them based on access to healthcare, care process, administrative efficiency, equity, and healthcare outcomes. If we look at the top-rated healthcare system, it's Norway, which has a universal healthcare system funded by taxes and employer contributions. Second is the Netherlands, which has social health insurance, like many European nations. And third is Australia, which has a mixture of public and private as well. It's important to note that the US is the lowest, ranks lowest in all categories except care process, and it's far behind all the other 10 high-income countries, despite being by far the richest. It also spends the most on healthcare. The US spends nearly 17% of GDP on healthcare. That's despite it being far, far bigger, its economy being far, far bigger than any of the other countries. Most other countries are spending between 9 to 12% of their GDP, depending on the type of system they have and the level of cost in that country. So we go to the first category, access. It's looking at affordability and timeliness, which is how affordable it is, obviously, how much it costs, and also how long it takes to access healthcare. So we look at that. The UK ranks first in affordability, and this is pretty obvious from what we've said, that there are very, very few out-of-pocket payments in the UK, and given that it's funded by general taxation, that also means it should, in theory, be a fair system in terms of who can access it. However, overall, the Netherlands is the winner in this category, the access category, and this is mainly due to the timeliness aspect. We all know that in the news, the NHS has had very long wait times, and that decreases its score in this area. Moving on to care process, this measures preventative care, safe care, coordination of care, engagement, and patient preferences, which is how much patients, the quality of care, and also how the patient's experience of it. So in preventable care, the UK, Sweden, and the US rank highest in terms of screening, flu vaccines, stuff like that. New Zealand and the US rank highest in safe care. New Zealand, Switzerland, and the Netherlands are best in coordinated care. In terms of admin efficiency, this is how well systems reduce documentation, paperwork, bureaucracy, and the best here are Norway, Australia, New Zealand, and the UK. And having the government run the system definitely helps with this, because the systems can talk to each other much better. Although, if you ever had to go between two hospital trusts in the NHS, you'll know how annoying it is that they don't have your patient records. And actually, the introduction of electronic health records could help this in the future. Moving on to equity, this is showing how income-related disparities affect healthcare. And the top ranking are Australia, Germany, and Switzerland. You might be surprised, given that I said that the UK is highest for affordability, that it doesn't come up in this list. But you must also factor in the fact that the UK has high levels of income inequality, and also factors such as obesity are highly correlated with social deprivation. And many areas in the UK are incredibly socially deprived. And this definitely doesn't help it in terms of equity. Moving on to the last category is healthcare outcomes, and here Australia, Norway, and Switzerland top. Norway has the lowest infant mortality of all the countries in this comparison, at only 2 per 1,000 births. Australia has the highest life expectancy after 60. So for those that make it to 60, they can expect 25.6 more years of life, so to live to 85.6 years. And Switzerland has the lowest number of preventable deaths, which is 83 per 100,000. If we look at the US in comparison, which in pretty much all categories has performed incredibly poorly, it has the highest level of infant mortality, the lowest life expectancy after 60, and has almost double the preventable deaths of Switzerland, also ranking lowest in this category. So we look at this report from the Commonwealth Fund, we can see that definitely universal healthcare leads to better healthcare outcomes, and there should be some definitely government involvement in healthcare. It's important to note also that the UK has ranked highest in this for quite a while, and perhaps it's lost its crown in this report because of the response to the COVID-19 pandemic, where the UK has been hard hit by that through poor mismanagement. But the NHS is, if we look at the distribution of healthcare systems, the top 5 or so are quite in quite a narrow band. It's interesting to see these different comparisons, and I just think it gives a better understanding of how well different healthcare systems function. I hope you've learned more about the healthcare systems of Canada, Switzerland, and Singapore. And I hope that you can see how different healthcare systems perform relative to each other. I hope you enjoyed this episode of Medisodes, and make sure to tune in next week for another great episode.